Good day, everyone. This is Luisa Atala of Natural TV. Healthcare services, such as doctors, make up a very large part of global economy. He is a wealth of experience to heal and help us. It's our pride to have in our program, empowering the people to improve their lives, to talk about diabetes, no other than Professor Dr. Serdar Güler, Professor of Endocrinology. Good day, sir.
Thank you very much. Have a nice day too.
Yes. Now I will begin already the question and answer so that you will have a vivid view of what is diabetes. Doctor, what is diabetes?
Diabetes is a complex problem, but mainly it's the name of having a high blood glucose, high blood sugar levels. High blood sugar means you cannot easily transfer your sugar from the blood to the cells, where it's the major fuel of whole body, indeed, especially the brain. Sometimes brain consumes about 50% of whole energy of the body.
Okay.
And this energy mainly comes from glucose, the sugar. Sugar is very, very important, but it must be at the specific place, inside the cell, to be a fuel for that cell. Any problem that leads to late entry of glucose, the sugar from blood to cell, causes diabetes mellitus. In this condition, blood becomes deprived of energy. Indeed, there is energy, but not in the proper place. It must be in the cell, but not in the cell, in the circulation. And in this problem, we try to place glucose to proper places. It's really very important. Having diabetes is very important.
What are the symptoms of diabetes?
When your blood sugar increases, you may have thirst, increase in thirst sensation. You feel thirsty. You want to drink more water. And because of high blood glucose, high blood sugar, you go to bathroom frequently. You urinate frequently. Urination becomes frequent and excessive. This is due to loss of sugar and with it some water. Thus the patient loses water and becomes more thirstier and loses weight. Because the cells do not gain enough sugar and loses energy. Thus you lose weight, you feel thirsty, you drink lots of water and you go to urinate frequently, even at night times. Sometimes some subtle symptoms may also occur. What do I mean with that? Because of increased blood glucose levels, people get infected more frequently and cannot be healed easily. Because of this, infections may be frequent. Itching of several sites may be frequent. In especially women, urinary tract infections may be more frequent. These are major symptoms. If the patient is a child, he or she may also be growth retarded if not treated accordingly because of lack of energy.
How about the pregnant women?
In pregnant women, we have indeed two categories. One may be a diabetic patient. A non-diabetic patient may be pregnant. The other time, the patient is not actually diabetic. She has pregnancy and has diabetes due to pregnancy. These are two different factors, but if someone is pregnant and has diabetes, this has significant consequences on the fetus. The fetus generally enlarges more than usual, and this causes severe problems during the delivery period and after the delivery period. This is especially serious for both the infant, the newborn, and the patient, the mother.
Okay.
And both may be needed to be taken care of intensively during and after labor. Because of this, diagnosing diabetes in pregnancy is extremely important. And the blood glucose levels must be kept almost in normal levels during this period. In general, we do not treat other patients in these strict levels. But in pregnancy, we have to lower blood glucose extremely to prevent the fetus and the mother.
So diabetes is also genetics, doctor?
Yes, indeed we have two types of
What are the two types?
diabetes, type 1 and type 2. Let me show in a view here.
Okay.
Here we see, in the first line, we see normal glucose metabolism. In the left side, you have a healthy pancreas, which produces insulin. Insulin is the hormone that moves glucose, the sugar, from the bloodstream to the cell.
Okay.
Without insulin, this movement cannot occur and cells may be deprived of fuel, the main fuel, glucose. In the first line, you see a healthy pancreas that secretes good amount of insulins, and the right side you see the cell. The insulin goes to the cell and lets the cell respond to glucose, thus taking glucose inside and doing whatever necessary with it. In the second line, in the middle line, you see type 1 diabetics. In type 1 diabetes, the insulin producing cells of the pancreas are depleted. Almost none cells exist. Thus, the body cannot produce insulin. Because of this lack, body cannot transfer glucose from blood to cell. In this type of patient, you have to use insulin treatment. Just insulin. Insulin is very essential and it is necessary for survival. Insulin is found in 1921. Because before that year, having a diagnosis of type 1 diabetes was almost equal to having a death sentence within 6 months. It's a very problematic disease if you don't have insulin. But thanks God, they have found insulin in 1921, and nowadays we can find plenty of insulin, lots of types of insulins, and the patients do not die. Insulin is very, very important, as has deserved 5 Nobel Prizes. Discovery and development of insulin, and it has the honor to have these Nobel Prizes. But type 1 diabetes is seen comprises about 5 to 10% of all diabetic patients. Most of the patients have type 2 diabetes. What do you have in that? The third line, pancreas produces insulin. But there is resistance to the effect of insulin. The cells do not respond well to that insulin. This is insulin resistance. And with time, the pancreas also cannot produce enough insulin to override that insulin resistance. So it can easily be understood that in the second type, we can use some medicines to increase this insulin sensitivity and to increase the secretion of pancreas. As you see, in type 1, we don't have the ability to use especially insulin secreting agents because insulin secreting mechanism is not over there. The pancreas lacks of the cells producing insulin. Thus, we have to use insulin. But in type 2 diabetes, we can use several medicines, oral medicines, to decrease blood glucose.
But for example, doctor, you're taking already insulin. Is this for a long treatment? Do you still use thoroughly the what do you call this, the insulin?
Insulin treatment is mandatory in type 1, but sometimes necessary in type 2 diabetes. With time, type 2 diabetic patients do lose the power of producing insulin. Their pancreas also loses insulin secreting cells, and particularly after 10 years, most of the beta cells, the insulin secreting stem cells of pancreas, have been lost, and they may also need insulin. And sometimes there are some specific conditions we have to use insulin instead of oral antidiabetics. For example, the patient may need an emergency surgery.
Oh.
For example, she or he may have acute appendicitis,
Yes.
appendix inflammation, and she may need acute surgery, or some heart surgery, open heart surgery, which is a major surgery.
Okay.
At these times, using insulin is simpler and more effective than using oral medications. Yes, and sometimes patients may get infected, and sometimes these infections may be severe. Thus, we have to use insulin instead of oral medications. These are conditions of using temporary insulins, but type 1 patients lead whole lifelong insulin treatment, and type 2 diabetic patients, after a certain period of time, may need it temporarily. But in type 2, depends on the patient. We may use insulin temporarily or continuously.
Okay. What are the complications of diabetes, doctor?
Indeed, before complications, I must admit that diabetes is a very frequent problem. Diabetes is seen very frequently in all over the world, including the Africa. In some persons, as you can see in this part, I may summarize this. If the color you see is darker, that means you have more diabetes. The lower ones either did not do any studies about that or have lower amounts of diabetes. As you can see in some parts, in the central parts, in the southern part and western part of Africa, there are some increased levels of diabetes. This is very important. Diabetes is a frequent disease, seen frequently in everywhere, also in Turkey and other countries. And one important thing is, it's not gender specific. It affects both women and men. Yeah, all genders are affected equally. And there's also specific better, the risk increases by age. As you get older, you have a higher risk of having diabetes.
Because nowadays, doctor, even young people have diabetes, right?
Yes, yes. Particularly type 2 diabetes. Let me talk about type 2 diabetes one more. We generally say that diabetes, type 2 diabetes, develops in patients who are prone to it. What this means? This means if your parents, if your father and or mother has diabetes, you have a greater risk for diabetes. Diabetes develops in these. If, especially, he or she does not take care of it. What does this mean? If the environmental factors also play a role. What are those environmental factors? Mainly exercise and diet. If a total of these, one gets fat, one gets weight, he or she has increased risk of developing diabetes. In summary, if your father and or mother has diabetes and you eat more and do not exercise, you have a very high likelihood of developing diabetes. For example, if you don't, your mother and father don't have diabetes, and you take care of yourself, you exercise and take care of whatever you eat, you may not develop diabetes during whole your life. If your father and mother has diabetes, you have an increased risk. For example, if you exercise regularly and regularly diet, let's say you will have diabetes at age of 60. If you do not take care of that diet and do not exercise, you may have this diabetes at, for example, age of 30 instead of 60.
At a very young age.
Yes.
Yeah.
In my residency, which began in 1990s, the definition of type 2 diabetes included it is generally seen after 40 years of age.
Oh.
Nowadays, people are getting fatter at early ages, even childhood. Because of this, we are currently seeing type 2 diabetic patients in childhood age, before age of 30, 18. At 12,
At a very
13,
young age.
yes.
Yes.
We usually have encountered type 2 diabetes after 40 years of age. Nowadays, we can see it at about 10, 12,
Yes.
13.
Yes.
This is also very important.
Is it because of the food they
Yes, and because of the food and lack
eat? Lifestyle.
of exercise. These are very important, especially in prevention. For patients who have diabetes, the best legacy for their children is making them move, always move, have exercise, and do not eat too much food. Please tell your children, grandchildren, do exercise and do not eat much. This way, your children or grandchildren will not be affected. This is the main prevention of diabetes.
Okay.
The parents have a significant role in this one. Besides parents, especially primary school children, primary school teachers have a very important role.
Education.
Yes,
Yeah.
they can easily teach their children about exercise and diet. This is very important. And the children they teach go to their homes and teach their parents. Yes, this is very, very effective, cheap, and easy method.
Okay. Is it true, doctor, that, for example, you don't have diabetes and you eat too much sweets, but you don't eat carbo, rice, and what do you call this pasta, but you are very into eating of sweets? Will you acquire diabetes?
This does not increase, indeed, the risk if you don't get weight, but this is an inappropriate way of eating habit, because the diet might be compartmentalized. Indeed, your body does not need any sweets. But is a very efficient mechanism. Whatever you eat, body converts it to glucose. Body converts it to sugars. Whatever you eat, whatever, it does not matter. Thus, one can born and eat no sugar and has no problem. No problem. But proteins are not so. There are essential proteins you have to take. There are some lipids you have to take. This is very important. But eating too much glucose does not per se induce diabetes. But it's not a healthy way of eating.
The rice, it's
have
carb.
You have to eat all of them
sugar.
in some known amounts. Basic food, basic meal must consist of always vegetables.
What are the complications if you have diabetes, doctor?
We have acute and chronic complications of diabetes. Before the invention of insulin, we have seen acute complications, comas related to hyperglycemia, higher blood glucose levels, and sometimes low blood glucose levels. But these are acute complications and are dealt when necessary. We mainly deal on chronic complications. After invention of insulin and several other medicines, these diabetic patients began to survive. They didn't die. And they survived to older ages. With this, we have began to see chronic complications and found that their eyes have been affected more frequently. Blindness.
The vision.
Yes, blindness in all over the world. The major cause of blindness is diabetes, high blood glucose. These diabetic patients, if not treated regularly, have more frequent attacks of brain problems, such as cerebrovascular accidents, strokes. They have become paralyzed more than their friends who do not have diabetes. They also have more myocardial infarction attacks, more heart conditions.
Okay.
Heart and brain conditions, strokes and myocardial infarctions are the main causes of death because of this. They have an increased 4 times increased risk of having stroke and myocardial infarction problems. Besides this, it also affects kidneys.
Kidneys.
Yes.
Yes.
In transplantation departments and hemodialysis departments, which are artificial kidney problems, almost 30% of the patients are diabetic patients. Diabetes increases this one too. Also, other vessel problems, artery problems, atherosclerotic problems may cause amputation of extremities too. After accidents, diabetes is the major cause of amputation for especially lower extremities. When we look at this, we see that diabetes affects every place in body in worse conditions. When, if you are not treated well. There are several treatment options. We have several medicines for this, and diabetes is a treatable disease. It's not curable. What this is, curable means you treat something and it goes away. Yes, we can not cure, but we can treat diabetes. We can treat and prevent complications of diabetes. For this, every diabetic patient must be in good follow-up with their physicians. Sometimes online consultations are also possible. After this time, there are several methods of online consultations, especially using the internet. Having a diabetes in your diabetes doctor in your region, and maybe in another region by online consultations, will be very, very effective for your treatment. Nowadays we have that. 40 years ago we did not have this option. There were not enough doctors anywhere in the world, and there were enough facilities, and there was no internet. Internet was not, did not exist 40 years ago.
True.
But nowadays we have several options for this. We also have several medicines. We have insulin. We have lots of drugs to use, and lots of doctors everywhere in many places of Africa. And we can reach other doctors through several mechanisms, particularly internet, nowadays.
Does diabetes also affects the hearing of a person?
Not so much, but there's also an increased risk of hearing problems too. Not so much, but the risk somewhat increases in diabetics too.
How about those those who smokers?
Smoking is an independent risk factor for almost everything. Thus, diabetes indeed is a risk factor for cardiovascular diseases. Smoking is another factor for this. If a diabetic patient, if someone has diabetes, he is in increased risk of having myocardial infarctions and strokes. And if that smokes, the risk doubles. Thus, we cannot recommend anyone to smoke, but especially for diabetic patients, do not smoke.
Because that's why there are many complications. So how do we treat that? If we sum it all, how do we prevent diabetes?
Prevention is easy. Don't gain weight. Be lean. Always take care of whatever you are eating, and always move. Somewhat move. Walk, run, do any exercise you want. I personally recommend, when we talk about exercise, people in Turkey or UK, people always say that, oh, I'll go to gym. You do not need gym. You take on your shoes, go away, walk away.
Walking.
Walk anywhere you want, anytime you want. This is the easiest, cheapest, and effective way of having exercise.
Yes.
You do not have gym. Yes, you may go to gym and do several other things over there, but this is not mandatory. Please move. Whatever you do, but please move. Don't sit. Don't sit. And do not eat. Do not eat much.
Diet.
Yeah, this is very, very important.
Okay.
Uh,
What are the lifestyle changes? And we know that there are plenty of drugs now, oral treatment, right,
Yes,
doctor?
yes.
Aside from the insulin.
We may summarize treatment very
Yes.
easily. Education is very important.
True.
Education is very important. I do not have diabetes, but I know what diabetes is and how to treat diabetes. If someone has diabetes,
Okay.
I think he must know diabetes better than I know, because I don't have it. If someone has diabetes and knows what diabetes is, what can be done, he or she can easily manage everything. Diabetes treatment is somewhat complex. Because of this, if he knows what diabetes is, he can easily do what is necessary.
Okay.
What is necessary? Lifestyle changes, mainly diet and exercise. We have talked about it
Yes.
lots of time in this speech. Other than that, but you see in the list, the first time, education. Second line, diet.
Lives.
Third line, exercise. We come at the fourth place. Doctors come at the fourth place. Yes. Why? Because our drugs do operate who? Diet and exercise.
Okay.
If they're
Yes.
not educated, if they do not make good diet plans or do not exercise, our drugs do not work so well. If they do this, they do efficient, very, very good. They do very, very good jobs. Everyone also must be in follow-up. Average doctor visit must be at least 3 months for people who are doing well, who have no symptoms, who have no problems.
Even the blood test.
Yes, blood tests and several other things. Because as we speak, diabetes affects every part of the body. Thus, we do not only look at the blood glucose. In the blood glucose is the very small thing we look in a diabetic patient. We look for blood lipids, blood pressure, condition of heart, condition of kidney, condition of everywhere.
Even the liver.
Everywhere, even the liver. Thus, regular follow-up is very, very important. Sir Jocelyn is a very important name in the field of diabetes. Lived long ago, and said that diabetes treatment is like throwing an arrow to a target. But the target is continuously moving. Sir Jocelyn properly stated that treatment of diabetes is throwing an arrow to a moving target.
It just
Thus,
says, doctor, that it is also a lifelong condition.
Lifelong condition. What you decide on today is the decision of today, not tomorrow's. We don't know what will happen tomorrow. Because of that, these patients might be on continuous and regular follow-ups. We have lots of medicines. Here's a chart that shows how to use medicines. Metformin is a very, very classical drug. And it's a very effective drug and king of the treatment. Metformin is indicated in every type 2 diabetic patients, but in some, we cannot use metformin. Thus, the main indication of metformin is every diabetic patients, if not contraindicated. Everyone must use metformin. Then we have several other medicines, oral medications, insulins, and other injectable, which are very effective and are adjusted according to the needs of the specific patient. What does this mean? Let's take 100 patients over here. All will take metformin if not contraindicated. Okay, at least 99 of them will take this medicine. In whom metformin cannot be given? In severe heart conditions, in severe heart failure or kidney failure or things like that. You cannot use metformin.
So we cannot use metformin for a long time because
Yes.
yeah,
Yes. If possible, lifelong, because it's a very, very important and valuable, very prized drug, very good drug. Thus, metformin is the mainstay of treatment. Because of this, every guideline says, do use metformin, do begin to use metformin, and continue it for lifelong, if possible. If possible.
Okay.
And almost all, in almost all patients, it is possible if he or she does not have severe heart or kidney condition. The major use of other medicines is important. All other medicines have important effects and important side effects.
Sure.
And besides this, they have also some drug interactions. If you use two medicines, both have effects and side effects. But besides this, they also interfere with each other too. If there is 3 drugs, the interference may be much more important. Because of it, using the drugs is very, very important.
So if you're maintaining your oral treatment like metformin, you have to change it after a few months or what?
Yes, we see the patients every 3 months
Then
and manage her blood glucose, blood pressure, blood lipids, heart, vein, whatever condition, and then adjust the treatment regularly. Here's a simple list of some drugs we use, their effects, side effects, prices, lots of problem here. This is a complex thing, and a patient cannot do this if he is not a medical doctor. This is very important, and it is very easy nowadays. It is very cheap nowadays. Please visit your doctors. They know what medicines are right for you, what medicines are not right for you. And this doctor will look after you. Look after your heart, kidney, liver, etc. Then look at the drugs. She will say, this drug is important for this one. This may harm the patient. This one will be very good. This one will be very good. And choose appropriate medicines for you. What are appropriate medicines? That will lower your blood glucose. That will lower your risk of myocardial infarction, stroke problems. That will help to regulate your blood pressure. That will help to decrease your lipid levels and will make you happy. And will not have significant side effects, and if possible will be cheap.
Okay.
A medical doctor will do this and continuously.
Okay. So we'll pause and we will back for a... Okay. Doctor, for the message for the people, where could they contact you?
My main message is take care of your diabetes very good. Please rely on diet and exercise. Their effect is much bigger than any medicine in the world. And our medicines work if you diet and exercise regularly. And for patients who have diabetes, please take care of your children and grandchildren. Make them exercise and strictly rely on diet. If you do this, they will also copy you.
True.
If you don't do this, they will say, oh, shame on you. You say this and don't do this.
Okay. So, Doctor, in behalf of the Natural TV management, we would like to thank you for gracing our program and fall in love in taking care of yourself. It is never too late to start your living well. And this is Luis Atala saying good day, everyone.